In this video, we discuss the step-by-step process of exchanging an IOL and fixing a 3-piece IOL in the ciliary sulcus. This patient presented with subluxation of a single-piece intraocular lens years after cataract surgery. In the preoperative evaluation of patients with subluxated IOL, it is always important to try to verify the type of IOL to know if it will be necessary to exchange it or if it is possible to simply reposition it. Another important detail is to try to assess whether there is anterior capsular support for implantation in the ciliary sulcus, or if some IOL fixation technique will be necessary. In this surgery, pars plana vitrectomy and exchange of the luxated single-piece lens for another 3-piece lens were scheduled. The surgery begins with anterior vitrectomy, removing the vitreous near the IOL and the pupil to be able to bring the IOL to the anterior chamber without generating traction on the vitreous base. Special care must be taken throughout the surgery to ensure that the surgeon's maneuvers do not damage the existing capsular support. The surgeon then removes the first haptic of the intraocular lens through the main incision to provide stability and prevent the IOL from plunging into the vitreous cavity. Next, he uses scissors to make a linear cut along almost the entire extent of the IOL's optical zone. This allows for the removal of the IOL with a small corneal incision, without the need for corneal sutures at the end of the surgery. After removing the IOL, the surgeon uses auxiliary chandelier lighting to better study the status of the capsular support. A 3-piece IOL is inserted over the pupil. The surgeon pushes the optical zone, capturing its edges in the pupil to facilitate the rotation of the haptics to the position of the ciliary sulcus. Whenever possible, it's important to try to still capture the optical zone of the IOL in the support, to ensure centralization and avoid IOL tilt. After implanting the IOL, the surgeon performs core vitrectomy, detachment of the posterior hyaloid, and shaving of the vitreous base. In this case, it wasn't necessary to perform peripheral endolaser, and since there were no peripheral tears, no vitreous substitute was used. The implantation of a 3-piece intraocular lens in the sulcus ensures an effective, safe, and inexpensive way to improve the vision of a patient with a displaced IOL. Whenever possible, the surgeon should try this approach, avoiding unnecessary iris, scleral, or intrascleral lens fixations.